This is the pathophysiology of Parkinson's disease and the pharmacological management by Zoe Lowry. So this is the pathophysiology of Parkinson's disease. Parkinson's disease is a progressive neurodegenerative disorder that is characterized by symptoms of progressive bradykinesia, rigidity, tremors, and postural instability, leading to trouble walking and frequent falls as a result. Parkinson's disease is pathologically characterized by, but not limited to, the loss of nigrostriatal dopaminergic innervation due to a degeneration of dopaminergic neurons in the substantia nigra pars compacta. This is an integral part of the basal ganglia, and dysfunction in dopamine levels creates an excitatory drive that disrupts motor control, causing Parkinson's disease symptoms. However, the reason for degeneration of dopaminergic neurons remains idiopathic. The presence of intracellular aggregates of acetylcholine in the form of Lewy bodies and Lewy nitrates is an indication of Parkinson's disease and other forms of neurodegenerative disorder. The basal ganglia are a cluster of subcortical nuclei deep to cerebral hemispheres responsible for motor control as well as motor learning, executive functions, and behavior and emotion. Proper functioning of the basal ganglia requires dopamine to be released at the input nuclei. The pars compacta is one of the two subdivisions of the substantia nigra formed by dopaminergic receptors. Substantia nigra pars compacta regulates the corpus striatum, contributing to fine motor control. One medication commonly used in the management of Parkinson's disease is carbidopa/levodopa, sold under the brand name Sinemet. Carbidopa/levodopa is a combination medication that contains two drug classes. Levodopa is classified as a dopamine precursor that converts into dopamine in the CNS and periphery. Carbidopa is a decarboxylase inhibitor, preventing the premature conversion of levodopa to dopamine in the periphery and allowing more levodopa to cross the blood-brain barrier. Lack of peripheral conversion of levodopa to dopamine decreases gastrointestinal absorption, preventing side effects of gastrointestinal upset. Once levodopa crosses the blood-brain barrier, it is converted into dopamine by decarboxylation in the presynaptic terminals of the dopaminergic neurons. The dopamine activates the postsynaptic dopaminergic receptors to compensate for the decrease in endogenous dopamine due to the degeneration of dopaminergic neurons in the substantia nigra. By increasing dopamine levels in the substantia nigra, carbidopa/levodopa compensates for a decrease in endogenous dopamine in the substantia nigra that is crucial in the regulation of motor control. Restoring the dopamine levels will in turn alleviate motor symptoms of bradykinesia, rigidity, and tremors associated with Parkinson's disease. These are relevant nursing considerations associated with levodopa/carbidopa. With the administration of levodopa/carbidopa, the nurse should consider providing accurate patient education on the medication. It is important for a patient to have a complete understanding of the side effects, importance of adherence to a specific regimen, and intended therapeutic effect to best improve quality of Emma's life through reduction of symptoms with minimal adverse reactions. Scheduling and performing medication reviews with Emma is an important nursing consideration to monitor the progression of her Parkinson's disease and to assess her treatment with levodopa/carbidopa. The most common adverse effect associated with carbidopa/levodopa is levodopa-induced dyskinesia, which involves hyperkinetic movements, including chorea, dystonia, and athetosis, usually occurring after a long term of carbidopa/levodopa, but may be sooner. By performing medication reviews, symptoms of levodopa-induced dyskinesia can be monitored to intervene with her administration if required. Performing medication reviews will also directly involve Emma in her treatment, and she can discuss any concerns she may be having to provide patient-centered care. Conducting regular mental health assessments is an essential nursing consideration when Emma is commencing levodopa/carbidopa, as confusion, delusions, psychosis, and hallucinations can occur, as well as sudden somnolence and increased depression. Conducting regular mental state examinations ensures any side effects of levodopa/carbidopa do not place burden on Emma's mental health and well-being. When beginning treatment for Parkinson's disease with levodopa/carbidopa, the nurse should consider referring Emma to a speech pathologist in order to determine if her swallowing ability has been affected by her onset of Parkinson's disease-related dysphagia. The speech pathologist will determine if Emma's ability to take oral medication has been limited, and interventions such as taking her medication with a thicker fluid need to be implemented to decrease the risk of choking. The nurse should consider referring Emma to a dietitian prior to commencing treatment with levodopa/carbidopa for her Parkinson's disease. The intended effects of levodopa can be impacted through protein-rich diets, as levodopa and dietary protein both utilize a saturable facilitated large neutral amino acid transport system to cross the gastrointestinal lining. To maximize therapeutic efficiency of the medication, Emma should be advised to take levodopa/carbidopa 1 to 2 hours after eating meals containing protein. To avoid malnutrition, the dietitian will work with Emma on creating a balanced meal plan and involve the nurse to determine the most appropriate levodopa/carbidopa regimen.